We have a team of both medical doctors and doctors of audiology. The medical team includes neurotology, specialists of the ear and skull-based surgery, otoneurology, neurology with a specialty for vertigo and dizziness, otolaryngology, ear, nose, and throat specialists, and 2 physician assistants. And on the right is our doctors of audiology. I'm really proud of them. They have just done a great job of serving our patients. So today, my agenda includes just clarifying what's on the market today. There's so many products since the baby boomers have retired. They have a lot of manufacturers have come out with a lot of products and delivery systems. So I'm attempting to clarify that for everybody because I feel like that step is really important to understanding what's best for you. I'll be going over the best fitting practices, realistic expectations, what hearing aids can and cannot do, and of course, addressing people's lifestyles. So just some hearing loss statistics. About 28.8 million US adults could benefit from using hearing aids. And only 67 to 86% of adults who may benefit from hearing aids do not use them. And so, you know, this is a shame. And the one thing I want to clear up today is just helping you be aware of what's out there on the market, because I think that that is part of the issue. So a successful hearing experience starts with understanding. And because there's so much on the market today, some people I feel they have decision paralysis. They don't know where to go. They don't know what to do. They see so many TV ads. There's extended wear, there's headphones, you know, there's Apple iPods. These are all the things that I actually just pulled from the internet. And it does look quite confusing. So I'm attempting to clarify that for you. So first I want to say I would never recommend this, but this does bring home the point that sometimes friends and loved ones get very frustrated when they live with a person with hearing loss and they don't do anything. So again, today I want to educate you on what is out there in the marketplace and how you can have a great experience. So part of that is just clarifying technology. You know, there's so many buzzwords and you know, about hearing technology. And so there's direct to consumer, and that includes hearables, smartphone applications, personal sound amplification products, self-fitting hearing aids, and there will be a future category labeled over-the-counter hearing aids. And then there's medical hearing aids, medical grade hearing aids as well. So direct to consumer just basically means the patient can obtain it directly from the manufacturer or particular outlet. This is a type of delivery system that does not require medical clearance from a physician or audiologist or any consultation from a hearing healthcare professional. And there are a number of hearing products that fall within this category. So hearables, smartphone applications, we call them PSAPs, self-fitting hearing aids, and over-the-counter hearing aids. So I'm just going to go through and basically explain each one of them and tell you the pros and the cons of each one of them. Hearables, it's a consumer electronic device. It's not an official term. This term was coined by Nicholas Hune in 2014. And it basically referred to any device that is capable of wireless connection. Since then, it is expanded to include any ear level device that has wireless connectivity, including headphones or earbuds. And then there are smartphone applications, and most of these hearables use some sort of application, whether it be on an iPhone or an Android. You can just download an app. These apps range anywhere from free to $10 for each application, and it provides simple volume controls and program adjustments and bass and treble adjustments. So I thought I would include an application that is widely used. It's called Chattable. You can download it for free for a limited version, or if you wanted a more extensive version, you can purchase it for $19.99 a month. It allows you to increase or decrease the level. You know, it allows you to use your hearables. You can even adjust a little bit of the background noise. It can be used with hearing aids as well and with cochlear implants. This is another app that's, I think, is really cool. And basically you could download Tunity and you have an application. And if you are in anywhere where they're streaming live television, you can actually put your phone up to the monitor of the TV and it will download that or give you the connection to the TV. And so you'll be able to live stream through your hearables or your hearing aids directly from the TV. And the TV could be used like if you're at a noisy bar or restaurant and you're watching a baseball game and you want to hear what the TV is saying, but it's too loud, you can have this app and it'll be going directly into your ears. And the TV could actually even be muted. So hearables, the pros are that it's easy to purchase online or in retail outlets. It's very low cost. It has a direct connection to smartphones and apps for streaming. It's hands-free, and improvement in signal to noise ratio was observed. So people that have tried this, they feel like, it does help in noisy situations when you make those backgrounds a little softer, and it's great for listening to music. So anything that you have occluding your ear really gives the richness and fullness to music. And so because these plug your ears, it's great for that. The cons are they could be cosmetically cumbersome. They might be uncomfortable and unnatural to wear all day. For instance, one of my patients came in and he had the Apple AirPods and he's just like, and they can provide a little bit of amplification. And he's just said, I feel really funny when I'm in a meeting because people think I'm being rude. So they're not really meant to replace hearing aids. They're just give you a little something to help your situation. So you could, if you wore them all day, feel occluded, plugged up, and there may actually be a delay going from the application to the earphone. So it might not be quite synced up. PSAPs are personal sound amplification products. These are basically electronic sound amplifiers. They have a microphone, a receiver, and an amplifier. They're usually very inexpensive. You see these all over the internet. The price can range anywhere from $79 to $1,250. You cannot make claims or PSAPs They are not FDA regulated. They cannot make claims about treating any hearing loss. You do not need a hearing evaluation to obtain one, and it's not customized, again, for individual loss. No licensing is required to dispense these. So the pros are they're very inexpensive, easy to purchase via the internet or retail stores such as Walmart or Sam's Club. Most likely they will help you hear in quiet situations. The cons are most of these devices use pretty low quality components. They may boost low frequencies because low frequencies typically make it seem like you're really like giving a lot of amplification. And so, you know, a lot of these companies, they give you those boosts in those low frequencies. They're usually bulky, cosmetically unappealing. And again, they're not regulated. No, we don't know if it's doing any more harm than good. No hearing test is required. You need to fit them yourself, leading to potential discomfort, and no warranty if you lose them or damage them. And then there's a different category called self-fitting hearing aids. These prices range from $1,850 to $2,400. They can be utilized. It utilizes a hearing test that you can take over the internet, or you can upload a hearing test to these companies. And your hearing aids are programmed and then they're sent directly to you. And you're supported virtually or through an application. So self-fitting hearing aids, they're highly convenient, they're easy to purchase. They typically come with a money-back guarantee, and there is support through an online healthcare professional. The cons are it relies on the accuracy of a hearing test. Nobody is looking in your ears, so you may not know that the reason why you have a hearing loss is because you have occluded ears, you know, with wax. Nobody's able to custom fit the receiver lengths or dome sizes. Patients often have difficulty navigating proper insertion or removal of devices, and there is no in-person support or help or attention. You may speak with someone new every single time you call them for remote support, and therefore there is no continuity of care. So this is what has been talked about for a while and anticipated by a lot of people: over-the-counter hearing aids. And legislation was passed in 2017 requiring the FDA to develop regulations for this category, over-the-counter hearing aids. The intent of the legislation was to offer adults with perceived mild to moderate hearing loss the opportunity to purchase a device on their own at a lower cost. So this officially does not start until the FDA finalizes the regulations. So if you hear an over-the-counter, this is an over-the-counter hearing aid, it's not what the FDA has approved because it's not released to the market yet. Over-the-counter hearing aids will not replace FDA-approved medically grade hearing aids that are currently on the market. So there are things, details about the regulations that we don't know, but what we do know is the average price is going to be around $1,000, maybe a little less. They're for adults only, 18 years and older, and they're approved for mild to moderate hearing loss, and will not require a hearing evaluation. We also know it will have a one-size-fits-most design because without requiring a hearing test, it is a little difficult to put the right amount of amplification in. So they're going to have a one size fits most. No FDA proposal for any return policy, no verification of the amplification that's in their ear. The FDA has not decided whether devices will be self-fitting, will have self-fitting options or have preset programs. So the pros are the OTC hearing aid bill will bring significant media attention and raised awareness of the prevalence of hearing loss. And that is a very good thing. Access and cost may entice more people with hearing loss to explore options for treatment sooner. So right now it takes a lot of people from the time that they're diagnosed to actually going and getting help with their hearing. So hopefully people will experience that that's not such a scary thing, and it's a very simple thing to impact your life. They're very easy to access. They will be very easy to access and affordable to most. The cons are it's based on a perceived hearing loss and not measured. The potential for over and under amplification. There is no formal assessment or risk for, so therefore there's a risk for an ear disorder going undiagnosed. You do not need a license to sell OTCs, and there's no one there to look in your ear. So again, that could be a problem. They're self-fitting, and oftentimes, that's very difficult for patients to do by themselves. There's no follow-up care. Troubleshooting will be on your own, and no verification or best fitting practices. You go there, you get the device, or you get it sent to you, and then you are pretty much on your own. You may have like a customer service number to call. So medical grade hearing aids, they are regulated. They have been regulated by the FDA for safety and efficacy. They are fit by hearing healthcare professionals and customized to person's hearing loss. One thing I think that separates these out from some of these other products is that hearing aid companies invest heavily in the research and development before bringing these devices to market. And so it trumps these hearing aid chips. Most of these companies have years and years of experience. Let's see. And prices range from around $1,000 to $8,000 for a pair. So these are the most popular brands that are on the market. Yeah, you'll see these being advertised. So medical grade hearing aid pros, they're fit by a hearing healthcare professional, either an audiologist or a hearing aid dispenser. There are free hearing aid evaluations. There's different levels of technology and pricing to fit most budgets. There's follow-up care. People will be looking in your ears. Based on the hearing test, we can tell if there might be something else going on, and healthcare providers are able to make medical referrals. So I just want to circle back to the free hearing aid evaluation. This is a really important step in obtaining a hearing aid. It's the time when a healthcare provider can gather information to make the best decision on your behalf. They will want to find out areas where you struggle to hear clearly. It is important to discuss your lifestyle in this period. Like, do you struggle on Zoom calls? Do you just struggle with TV, movies, theater? And most of these things can be addressed with the latest technology and accessories. And this also gives the provider an idea of what technology you need. Someone who is working, very social, they like to be in challenging noise environments, they might actually need something different than someone who leads a very simple lifestyle, who may communicate with one person only and maybe just watches TV. So again, with medical grade hearing aids, there's different levels of technology. The cons are, it may be difficult for patients who have limited access to transportation or are homebound, and kind of ties into, it may take multiple visits to obtain just the right physical fit and acoustic fit. So that sums up the majority of the technology that's on the market. I hope this information is useful and it'll help you make informed decisions. This next slide is just a study that I ran into, and I thought it would be great to present this because it tells all about the different attributes hearing aids can offer. And this particular study looked at a sample size of almost 15,000 patients. And the purpose of it was to find what the most desirable attributes are for patients that are choosing hearing aids. And so what they did is they asked these patients to go through this questionnaire, the 21 question on this Help Me tool. So I'm not going to bore you with like details. I just want to show you what this tool looks like. It's just basically a questionnaire. They asked patients how much hearing loss they have, how important are the following when purchasing a hearing aid, improved ability to hear friends and families in quiet settings. They had a section on music and audio streaming. They looked at phone calls. Do you have difficulty with phone calls? And do you have a mobile device? Do you have trouble hearing on a landline phone? So these are all questions that they asked these patients. And section 5 was device preference. Do you like a hearing aid that you don't have to change batteries? You can just recharge. And how cosmetically concerned are you? Because there's different options for that. How reliable of the hearing aid? Everybody wants a reliable hearing aid, but the other was what type of mobile device do you use? And so it just went into detail on all the different attributes a hearing aid has. And so this slide is very hard to read, I understand, but on the left side are all the different attributes, and going and looking at it on the bottom, these were what was important to the patient. So the lighter the color, not important at all, to the darker color, extremely important. So of the 21 hearing aid attributes, the 4 most favorably rated were improved ability to hear friends and family in quiet and in noise, physical comfort and reliability. 1/3 of the respondents preferred high-end technology or premium technology and favored all types of advanced attributes. The other 2/3 preferred either advanced or a best match to all of their preferences. So I felt like this study was not only interesting, but also allow you to be aware of the different attributes that that your healthcare providers should consider when figuring out what hearing aid is best for you. So hearing aid fitting considerations. I feel like the hearing aid fit is one of the most important factors to hearing success. and it includes the physical fit and the acoustic fit. So the hearing aid has to be comfortable. It has to be able to stay in your ear. You know, people want it to be usually the least visible as possible. And so the physical fit is very, very important. But just as important is the acoustic fit as well. The acoustic fit is how much amplification do we need in the hearing aid? And real ear verification is one of the most important tools for fitting a hearing aid for your healthcare provider to have. It receives little attention and is often underutilized in most clinics. But this is the only objective measure that can tell us if a person is being under, over, or properly fit. It uses researched targets to let you know how much gain to give at the different frequencies or pitches. The goal of these research targets is maximizing speech understanding. So if you look at the slide on the left, we're able to put in a patient's hearing test. And then we actually put a microphone down your ear canal because we want to see how much sound pressure level or gain is going into the hearing aid at every single pitch or frequency. And so based on the hearing test, we use a research target, and I'm going to get to that in the next slide. So I know this looks like gobbledygook, but just bear with me. I'm going to try to simplify this. The crosses on each of the graphs are the research target, and this is what you know, we want to use to be able to guide us to fit a hearing aid. So the crosses are the goal. The dark line is what your hearing aid is doing. And the bottom numbers, that goes from bass to treble. Those are the different frequency levels. And so that goes from bass to treble. So if you look at the screen, on the left side, you will see that that green line is not meeting the crosses. And so this person is probably a little underfit, not a little, a lot in the low frequencies. And on the right side, you see that it is perfectly meeting the crosses. And so we can feel as healthcare providers, audiologists, that we did our best to be able to fit this patient with the proper hearing aid and program it properly. We also use this tool quite a bit for, you know, to see where patients, you know, for counseling, a counseling mechanism. If a patient says, you know, I just don't hear very well, and you look and you see, oh, well, your hearing aid is turned down so much, you know, we're going to have to talk to you about keeping the gain up so that you can benefit from the gain. So as you can see, I love real ear verification. It's such a important and handy tool. Realistic expectations is also a factor for the key to success. People sometimes think, oh, you know, I'm going to go in, I'm going to be fit with a hearing aid, and then I'll be done. But there's so much information that goes into a hearing aid fitting, and you want someone to be able to insert them correctly, remove them correctly. We want them to be able to know how to clean them. And so a lot of times that just takes so much information for just one visit. So the average is about 2 to 4 visits. And adaptation to various noise environments. So if somebody comes in and they have never worn a hearing aid and they've had a hearing loss for 20 to 30 years, it's going to take a little bit of time for them to get used to all the sounds that they've been missing. It's deprivation. Your ear has not heard those sounds in a really long time. But there's hope for those people, and consistent usage helps, with the adaptation process. Your brain will say, hey, I don't really need to hear those little sounds so much, my feet walking, and then eventually it puts it in the back of their mind. So sometimes this can take, up to a couple weeks to a couple months. But once they have adapted, those sounds don't bother them anymore. And so we can always tell if a person hasn't been wearing their hearing aids, and we try to use this, just let people know that it is not a quick fix. And then audibility versus understanding. Hearing aids can make speech louder or audible and help you have a better chance of understanding speech. However, some people, when you make the sounds louder, it is just not clear. So in these cases, there is damage to the hearing nerve. And you can speak with your hearing professional to see if a hearing aid would benefit you. If not, there is always other medical options, such as a cochlear implant, but we're not going to get into that during this talk. So this is just an example of speech clarity. On the left, you have a good, healthy hearing nerve. You have the sound coming in. This healthy nerve or cord is relaying the information correctly up to the auditory brainstem. And then on the right, you see the ear system, and you have a damaged cord or damaged hearing nerve. And so that is also carried up to the auditory brainstem. This can be somewhat determined by a comprehensive hearing test. We do word recognition at a loud enough level where you are able to hear all the words. And even though it's louder, there are some patients that get poor word recognition scores. And so that kind of tells us if they would be a good hearing aid candidate or someone who should think about a cochlear implant. So addressing lifestyles, this is also very important. There's some people who they really struggle watching TV. And now in today's technology world, there's no reason for this. There are a lot of devices that you could get that hook up to your TV. You can hear them directly through your hearing aids. They have TV listening devices. Patients sometimes have trouble zooming videos, and there are things that you could hook up to your iPad or computer. And hearing in noise, there are remote mics that take the information from the speaker to your hearing aids or hearable device. Other factors that lead to success are consistent daily usage, as we talked about, listening and speaking strategies. So we didn't really go into this, but just talking with your family about, talking to you in the same room, not upstairs. When you go into a noisy restaurant, maybe find a booth and have the booth in back of you, and things like that. And we would be happy to speak with you about some of those for our patients. And just have a positive attitude. We feel like, the patients that come in and they're really excited and they're motivated, they usually do really well. So those are just some other factors. So this is just sort of the roadmap that someone that goes directly to a consumer goes through. So they're ready to get their hearing aid. There's a green light. They go directly to purchase their direct-to-consumer product. They fit it. And we feel like, you know, there's so much that goes into a proper hearing aid fitting, that, and even just an insertion into your ears and how to clean them. They're just left with questions. So we feel that this is really the roadmap to success. Someone is ready for a hearing aid. They get a comprehensive exam. The exam results is discussed with the patient. Any medical related concerns are addressed at that time. I mean, we're able to see like if there's an asymmetry, or we're also looking in the patient's ear. And different configurations of hearing tests can tell us a lot about their medical issue. And then they have a hearing aid evaluation. So this hearing aid evaluation we talked about earlier addresses lifestyles, just the problems that you're struggling with. We do a lifestyle interview, and we go over technology and style selection. So are you cosmetically concerned? Do you want something in your ear? And we give you the pros and cons of each one of these devices. And then we'll custom order the hearing aid. When the hearing aid comes in, we custom fit the hearing aid. So the physical fit of the hearing aid needs to be addressed, as well as the acoustic fit of the hearing aid. And so that's an hour-long appointment for us anyway. And that is where we kind of find to use in this session, this fitting session, we do use real ear, and we counsel on how to use it, how to insert it, how to clean it. Then the patient goes out and they try it in the real world. They will try it in all the situations that they typically were struggling in, and see if it took care of those issues. And then they come back and they tell us what's working for them, what's not working for them. If there's better technology out there, if there's something different that we should be trying. And then we feel that ongoing care is so important. We never want patients to feel like they are left high and dry. We want to be able to address their needs as they come. And so we feel like that really leads to this happy camper at the end. So in summary, knowledge is power. Knowing what's out there on the market, what works, what are the pros and cons, identifying the most appropriate technology for you, the best fitting practices, realistic expectations, knowing what a hearing aid can and cannot do, and ongoing support of these, you'll have a very successful hearing aid experience. So thank you so much for logging on and listening to my talk. And we are just now going to open it up for questions. Okay, should my audiologist use the real ear test every time I need a tune-up? So that is a really good question, because this is what I've seen. I've seen patients come in and they haven't worn hearing aids in a long time, and they have the sensitivity because they need the adaptation period. And so what happens is, you know, an audiologist might be like, oh, okay, well, if it's too loud, we'll just turn it down. We'll turn it down. And so, you know, after a couple sessions of that, you might see that they are being really underfit. And so it just really gives us an idea of what's going on. It depends on what the tune-up is needed. So, but I really like to use it as a guide for fitting hearing aids. The next question is, wouldn't over-the-counter hearing aids without a hearing test just make sounds louder? Could those devices really help understanding? That is the question of the day. It's really hard to say what kind of gain is going to be in these over-the-counter hearing aids. You might be able to adjust them on an app on your phone, but the scary thing for me is that we don't know exactly what is going on in these hearing aids. Once they are approved, we would love to take a look at them and run real ear and see what they're actually doing in those devices. I hope that answered that question. So if I choose a hearing aid and it doesn't work out, what happens then? How many options do you offer? So that's also a very, very good question. So for the hearing aid evaluation, we like to look at everything. We look at, your budget. We look at the price, your budget and the levels of technology. What is best for you? We look at your lifestyle. And so we try to really narrow it down before we even order the hearing aid. And so, another thing is it does take a lot of time to adapt to the sound quality, and every manufacturer has a different chip in them. And so the sound quality is different. So we try to get it right at in the beginning. But let's say it doesn't work out. There is a 45-day trial period in law in California, actually, that you are able to return your hearing aids in 45 days. Practice offers all the major manufacturers hearing aids, and we also offer surgical options, such as the Esteem and ear lens, which is a totally different type of hearing device. So the best thing you would want to do would just be make a hearing aid evaluation appointment. I think, okay. Question, why didn't you talk about surgical models in the market? Because technology and products that are on the market. The surgical models, I believe we did a talk on the Esteem, and there will most likely be talks about surgical options. And we talked about cochlear implants last year as well. And there will be talks on that in the future. Any other questions? Okay, how much does your initial visit cost? So we are a medical audiology practice. We do take a lot of insurances. So you can look on our website and see what insurance companies we take. And they typically pay for the hearing aid, they typically pay for the comprehensive hearing exam and the physician visits. So if you don't have insurance, we can talk to you. I would encourage you maybe to call our office and we can talk to you about what your issue is and your needs are, and then give you an idea then.
All right, folks, it looks like that might be all the questions. Feel free to keep sending if someone is out there typing. But we just wanted to thank everyone who joined us and Cheryl for this incredible talk. And if you know someone who'd like to listen again, or you'd like to share with someone you know, keep an eye on your email inbox. We'll be sending out a recording of today's presentation, including the question and answer session in the next few days. And this talk, along with previous talks that we've done, are also posted to our YouTube channel and should be up later today. You can go to YouTube and search Showhead Ear Associates Medical Group and check us out there. We'd also like to let you know that you can stay connected with us on our social media channels for the latest and what's going on with our practice. And we really look forward to connecting with you again next month. We'll be doing another topic, and we just can't wait to see you guys then. Thank you so much for joining us, and thank you, Cheryl.
Thank you very much.